This is my favorite article by Dr. Phil Zeltzman, Veterinary Practice News. When dogs are limping for a long time, the muscles actually start to atrophy or waste. They get skinny and scrawny, and we can see that here because he's using these red lines to measure the thickness or the bulk of the muscles. You can see this is the healthy knee side, and this is the CCL tear side. And look at the difference in the length of those red lines. These muscles are wasting, and that is proof that the dog is not using their leg as well as they should, and they're not doing it because there's probably a CCL tear in there. This is a growth plate, so this is a young dog. Let's keep going. All of these things that he's mentioning, I'm not going to mention all of them. I will just pop through and do some because it's too advanced and it's vet stuff. The number one is pointing out swelling or inflammation inside the knee joint. You can't see this with the naked eye, but it's actually happening inside the knee joint. So joint effusion. Number 2, that's fat pad sign. The fat pad gets pushed because the effusion is taking up too much space inside this knee joint. I want you to notice, this is called the cortex, right? Or the cortices, multiple cortexes of a bone. And I just want you to notice how smooth it is out here. See that nice clear margin? Well, notice here, see how it's fuzzy? See how it's a little pointy? That would be osteoarthritis. That's what number 4 is pointing to, is osteoarthritis in the knee. Many dogs who are diagnosed with CCL tears come into the vet already having signs of osteoarthritis. Also, I want you to notice the different densities you're seeing on the x-ray. Air always shows up as black. Bones are calcific. They show up as white. Metal, which you'll see in later x-rays, shows up as ultra white, the brightest white. That would be the TPLO implant and the screws. Muscles show up as shades of gray. So this is all the musculature. And you remember we saw that on the previous x-ray. See the grayness compared to the whiteness of the bone? And again, the black is air. Here he's calling this devil's horns, and you can see now we're looking at a different view. This is called a craniocaudal view, or the front to back view of a dog. The kneecap, the bottom part of the femur, these are the femoral condyles. This is the tibial-plateau, the fibula, the tibia. These little points are osteophytes or bone spurs. And these are not normal for a healthy knee. You would not see those little pointy projections. That is another way of showing osteoarthritis. There are the bone spurs again, there. And so here what he's showing you is medial buttress. So in order for a vet to know whether there's medial buttress, they're kind of kneeling behind your dog and they're wrapping their hands around both sides of your dog's knees, and they're feeling the inner margin of your dog's knee joint. And they can feel this palpable scar tissue that forms called the medial buttress, but you can actually see it on x-ray. You see that? This is the edge of your dog's thigh. So if you were standing behind and you were just running your fingers down the inside of your dog's leg, right by their knee joint, that's this area. This is the outer part. Again, this is a normal knee. See how nice and smooth all of the cortices are? See how smooth and beautiful? See how this isn't all hazy in here? Now look, hazy, swelling. Oh, I should have pointed out the tibial plateau. This slanted area is the tibial plateau. This is the fibula. This is a side view of the dog, and you can see the bottom of the kneecap has a bit of a spur. But here they're really just wanting you to see joint effusion. There's a picture of a vet palpating or feeling for a medial buttress in a dog's knee. See how they're crouching down? This vet is running their hands up and down the inner part of the dog's knee, feeling for that medial buttress. If they feel it, that's one of the signs that show the CCL is torn. And when I say CCL, I'm meaning the cranial cruciate ligament, not the caudal cruciate ligament. We're just going to call it a CCL. This is a front to back. Now here we're on a different website. I should have also mentioned the different website here. Let me just go here. Today's Veterinary Practice. This was the one with the vet palpating the dog's knee. You can see the URL here. This one is Canton Animal Hospital, cantonvets.com. Looking at the dog's knee from front to back. Here you see the femur, the kneecap, the sesamoid bones, the fibula, the tibia, the TPLO plate, the screws in the head of the TPLO plate and in the tail of the TPLO plate. A lot of people wonder why the screws are so long and they're exiting the other side of the cortex of the bone. Well, that's because the vet wants to get good purchase, meaning they want to make sure that that screw is able to really grab onto that bone, and it makes sure that the TPLO implant stays exactly where they want it. They want these screws to be in what's called the proximal segment, which is this area that they've cut up above the bone cut, and this is the bone cut here. They want to make sure these screws are in the bone and not protruding into the joint space. This is one of the reasons why a TPLO planning is so important. CCL tears in dogs are not the only reason why dogs are limping. Sometimes they have underlying conditions that are quite serious, and that's what I'm going to show you now. So let's say this person took their dog for a walk and they came back limping, or they've noticed an on and off limp for days or a month or something, and they finally take their dog to the vet. And the vet examines and says, well, it could be a CCL tear, but let's just get an x-ray to make sure it's nothing else. Well, here's an example of what osteosarcoma looks like, a very painful and aggressive form of bone cancer in dogs. If you live in Arizona and any of those other kind of desert-like states, there is a fungal disease that dogs can get. And this is an example of valley fever. You can see these initial symptoms that dogs have, but then they can go on to develop lameness. And they do that because the fungal infection has spread to their bones, and you see the top of the tibia. Let me just go back and show you normal. This is a normal bone. You see the density of it. You can see the shape or the contour of the bone and how that gets lost here. This dog is limping, just like a dog that would have a CCL tear. Here we have an example of a type of arthritis called IMPA. Do you remember what the bone looked like on the side view of the femur? And then you look here, and this bone is actually eaten away. It's erosive. There are different forms of IMPA, but this is the erosive form. This dog is also coming into the vet limping. Lyme disease can cause limping. My dog was limping, but on the front leg with Lyme disease. LawndaleVets.com. Remember when Dr. Zeltzman was talking about the devil's horn sign? You can see it here too in this dog. See the pointy osteophytes or bone spurs on the tibia? You see how there are all these different reasons why dogs can limp, and it isn't just torn CCLs. If these doctors didn't get x-rays, they wouldn't be able to see these various things. If you think your dog is going to have CCL surgery and the vet's wanting to do TPLO or even lateral suture or TTA, just get x-rays first. Be on the safe side.